Always a pleasure. Thank you, Hannah. Yes, it's always a pleasure to be with the Office Management Group. Some of you may have seen me at the Office Management Conference, the Office Management shows. I'm going to share my screen with you now and just go through the basics of how to save a life. It is something that's really passionate to me. The first few minutes can make an enormous difference. The more people we can share this with, the more people that know what to do. Hopefully, the more lives we can save, and it doesn't take very long to learn the basics. So I'll share my screen now. So great. Hopefully you can now all see a screen that says how to save a life. As I say, my name's David Hewitt from East Saxon Training. My background's in the health service, but I was also a volunteer with the East of England Ambulance Service. So I've had to put some of these skills into practice in real life, and I've been teaching first aid for a very long time and still run lots of first aid courses and do lots of training in hospitals. Why is this all important? Well, here's some figures for you from the British Heart Foundation. If you're wondering what people die of in the UK, generally speaking, it's circulatory disease. So heart attacks, cardiac arrest, stroke, things like that. As you can see, about 480 people will die every day, uh, typically. So sadly, 480 people die today from heart and circulation disease. And it is the risk factors for those you probably all know about eating, drinking, smoking, exercise, and all those things. Getting older does increase your risk. But 130 of those people will be under the age of 75, and some of those will be much younger than that. There's about 7.5 million people living with heart disease. Lots of people will be admitted, about 270 people admitted to hospital every day of a heart attack. So there are lots of people out there who are at high risk, but every now and again a younger person is affected as well. Why I'm doing this seminar today is about the golden few minutes. The organisation that kind of sets the standards for this in the UK is called the Resuscitation Council. So if you want to learn more in more detail, have a look on their website. But you can see on this graph that along the bottom is time and up the side is your chance of survival. So the red bar is when people do CPR. CPR stands for Cardio Pulmonary Resuscitation. And you can see that if somebody does CPR in the first 3 or 4 minutes, people have got maybe a 50% chance of still being alive a month later. Okay. Um, but if they don't, it drops right down to 20%. And you can see as more time goes past, um, less and less chance of survival. And after about 20 minutes, there's no chance of anybody of surviving at all if they haven't had CPR, but still a slight chance if somebody has had some CPR. So some of those are sort of anomalies with the non-CPR. So really, it's the first 8 minutes that makes a big difference. So calling for help early makes a big difference. So the first thing I want to share with you is to know the signs and symptoms of somebody having a heart attack. So a little video for you from the British Heart Foundation, which goes through the basic signs and symptoms you can all look out for in a friend or colleague who might be having a heart attack.
So you're here to find out what it's like to have a heart attack. Well, we don't have much time because with heart attacks you never do. Well, let's start with the first symptom most people think of. Yes, chest pains. Well, we've all heard of the classic chest pains, but it may not always be that severe. It could be a bit of tightness or discomfort in and around the chest. No doubt you'll shrug this off. I mean, slight chest discomfort, tightness, not worth worrying about, right? Wrong. What if it spreads to your arms? Still not convinced you're having a heart attack? But what if you feel dizzy, lightheaded? Oh, still thinking, don't make a fuss. What if it spreads to your neck, to your jaw? You're probably thinking, tough it out, it will pass. What if it doesn't? The longer you leave it, the more your heart dies. How about difficulty breathing? Rising panic, sweaty.
Sorry, I've got a
Indigestion, last night's curry, stress. But what if it's your body telling you to get help? Don't kid yourself. If you're having chest pains or discomfort with any of these symptoms, or even if you're feeling unwell, dial 999. Now, this may surprise you. The ambulance service would rather see you and discover it's not a heart attack than arrive too late. Every second counts. I know you think you feel embarrassed if it's not actually a heart attack, but imagine how you'll feel if it is, and you left it too late. Imagine that.
So a slightly dramatic video there. I hope you could all hear and see it okay. Signs and symptoms it was going through, they're the classic chest pain, as I said, everybody's heard of. But it's worth saying that that symptom is less common with women. With women, you have more of the radiated pain that spreads down your arm and up, maybe up to your neck. And because of that, sadly, 60% of the time in hospitals, we misdiagnose women's heart attacks. I'm very sorry to say. So if you've got any of those symptoms and you're really feeling unwell, or your colleague is, make it really clear to the health services that this isn't normal. This, I feel like I'm having a heart attack, and to kind of really stress what symptoms and that you're feeling, because we are unfortunately very good at misdiagnosing women's heart attacks, and because of that, all of this is CPR is less successful on women because we tend to diagnose heart attacks later and be less prepared, sadly. But yes, those are symptoms you might see, the crushing chest pain. If somebody's having a heart attack in the office, 7 out of 10 people survive their first heart attack. So there's lots we can do to help them. Typically, we would obviously dial 999, call for help, but sit them down, sit them up into what we call a W position, which is basically sat up with their back against the wall, but lift their knees up a little bit to support them further. And encourage them to take some aspirin if they've got some aspirin. So 300 milligrams, which is sort of 2 of the 150 milligram tablets, and they can chew those. Don't swallow them, chew them so they absorb quickly in the mouth. Aspirin's a slight blood thinner, and that might help. Now, obviously, we might worry about allergies and things like that, but when you dial 999, they will often say to you, check with the patient if it's okay for them to take aspirin. So it's the advice emergency services will give you as well. If they suffer from angina, they can take their own medication, but if it's a heart attack, that's not going to help. So they're the basic signs and symptoms to look out for. If unfortunately they collapse and they're not responsive, you need to check if they're breathing. That's what the emergency services would do. So if somebody's lying on the floor, to check that they're breathing, the first thing you have to do is to do what we call a head tilt chin lift. And you can see the picture there. So tilting the head back gently and lifting the chin right up so it's pointing at the ceiling. You have to tilt the head back quite a long way. And what that does is it lifts the tongue off the back of the throat a little bit and allows them to breathe properly. And then you look down their chest for 10 seconds, count out loud to 10 while you're looking at their chest, and you're hoping to see 2 or 3 breaths in those 10 seconds. If you do, that's what we call somebody being unconscious but breathing normally, because you're seeing 2 or 3 breaths in those 10 seconds with their head tilted back, but they're not responding to you. They're completely unconscious for whatever reason. So while you're waiting for the emergency services, it's really important to roll them into the recovery position, because if you vomit lying on your back, it's nearly always fatal. You either choke to death on the vomit or they die of us in hospital a couple of weeks later of a lung infection. So we don't leave unconscious people lying on their back. So I want you to roll them onto their side into their recovery position. So I've got a little short video now that will show you how to do that. Once you've identified that your casualty is unresponsive but breathing normally, you're going to place them in the recovery position. This maintains an open airway in case they vomit. You start by kneeling next to the patient and pulling their hand towards you. You take their other hand and place it across their cheek. You then lift their knee and use the knee as a fulcrum to pull the patient towards you. They will roll onto their side. You can adjust the knee to make sure they don't roll back and make sure they have an open airway. Check that they are still breathing. If they're not breathing or they stop breathing at any time, roll them back and start CPR. Stay with them, making sure that their airway is open while you wait for the emergency services.
Once you've got,
What a handsome chap on that video there. Unfortunately, if they stop breathing, you don't see those tool-free normal breaths. So then what we call unconscious and not breathing normally. In other words, sadly, they're dead. You can't make it any worse at this point. If somebody's unconscious and not breathing, you can't make it any worse. Technically, they're dead. You've got to start CPR to try and help them. So the next little video just shows you how to do CPR, which is, as I say, cardio pulmonary resuscitation.
casualty is unresponsive and lying on the floor. We're now going to practice doctors ABC. The D stands for danger. Check it's safe to approach your patient. There's no vomit on the floor, broken glass, or anything that could injure you. Particularly important if you're outside that there's no road vehicles that could harm you. Having established it's safe to approach the patient, the R stands for response. Always begin by shouting at your patient, because hearing is the last sense to go, so they may be able to hear you even if they can't respond. Shout at them clearly, but if there's no response, then firmly squeeze their shoulders and continue shouting at them. If the patient doesn't respond, the S stands for shout for help. So call for a colleague, or if you're on your own, take out your mobile phone, dial 999 and put it on speakerphone. Tell them you have an unresponsive patient and you need help urgently. While you're waiting for the emergency services to arrive, you can go through the ABC. The A stands for airway. First of all, check the patient's airway is clear. If there's any obstacles you can easily remove, please do so. But don't poke your finger into the patient's mouth, as this could make the situation worse. If there's vomit in the patient's mouth, tilt the head to one side, massage the cheek to try and get some of the vomit out. Don't take too long, 6 or 7 seconds just to clear their airway. Once their airway is clear, carry out a head tilt chin lift, which is putting one hand on the forehead and 2 fingers on the bony part of the chin, and tilt the head back. This lifts the tongue away from the back of the throat and allows the patient to breathe normally. Now look along their chest to see if they're breathing. B for breathing. We're going to count up to 10. If there's no signs of normal breathing during those 10 seconds, and for an adult, we're looking for 2 or 3 rises and falls of the chest during those 10 seconds, then the patient is unresponsive and not breathing normally. We're therefore going to begin CPR, the chest compressions. Place a hand in the center of the chest and push down 2 inches to 5 centimeters. A good rhythmic speed, 1 or 2 beats per second, 100, 120 beats in a minute. Keep doing the chest compressions. This is what we call compression-only CPR, and is the minimum you might want to do while you wait for the emergency services. However, you could also consider rescue breaths. To carry out rescue breaths, which are particularly important on children, give 2 rescue breaths to every 30 chest compressions. Begin by pinching the patient's nose and tilting the head back as you did before, putting your mouth over their mouth and blowing into the patient. About 1 second for each breath. Watch the chest rise and fall each time. After the 2 breaths, resume the chest compressions, 30 chest compressions again. You may have in your first aid kit a pocket mask. These are particularly good for first aid as they protect you from breathing in germs and vomit that might be in the patient's mouth. Pop the pocket mask out of the box and place it over the patient's nose and mouth. Push down firmly with your thumbs on each side of the valve. This will leave your fingers free to grip the patient's jawbone and tilt the head back. And then, as before, blow firmly into the patient twice, allowing about 1 second for each breath and watching the chest rise and fall. Once you've given 2 rescue breaths, resume the chest compressions. 30 chest compressions to 2 rescue breaths. Keep going until the emergency services arrive to help you.
Good. I hope that made sense. We'll take some questions at the end. So that's what we call compression only CPR. You saw just doing chest compressions there, and you may or may not want to do some rescue breaths, as I said. But this graph shows you people's chance of survival based on how long it takes EMS, that stands for the emergency services, the ambulance to turn up. And again, as you can see, if the ambulance turns up in the first 2 to 4 minutes, people have got maybe over a 50% chance of survival. And then it drops off really, really quickly. And basically after 10 minutes, there's almost no chance of anybody surviving if emergency services hasn't arrived. What makes the big difference? What do the emergency services do that makes a huge difference? The big difference is the emergency services carry an AED, which stands for an automatic external defibrillator, or a defib, as some people call it. So you may have one in your office. If not, I can talk to you about the pros and cons of buying one for your office. But that's what makes a big difference. If you get that on in the first 3 minutes, it makes a massive difference to the people's chance of survival. If there's a delay, as you can see, their chance of survival drops off really quickly. So if you are lucky enough to have an AED in your office, anybody can use it. You don't necessarily need any training. You turn it on, it talks to you and it tells you what to do. But I've got a very short video next which just shows you how to use a typical AED in the office.
Having established that our casualty is unresponsive and not breathing normally, we're going to start CPR. However, as soon as help arrives with an AED, which is an automatic external defibrillator, we're going to use that as quickly as possible. It's generally the AED that saves patients' lives, so do not delay in using it. You start by cutting the clothing away and making sure that there's clean, dry skin to put the pads on. Open the AED and the pads are inside and they have pictures showing you where to put them. One on the rib cage and one on the clavicle. Make sure there's nothing metal, so any jewellery should be pushed out of the way. An underwire bra could be cut away. If the patient has a hairy chest, you can place both pads on the rib cage to avoid it. If the patient is wet, dry the patient with a towel or a t-shirt or whatever you have. So make sure the pads are on clean, dry, bare skin. Once you turn the machine on, it will talk to you and tell you what to do. Plug the lead in where the flashing light shows if you haven't already done so, and follow the instructions. Resume CPR, chest compressions, until the machine tells you to stop. Once the machine tells you to stop, stop chest compressions, make sure nobody touches the patient. It'll analyse, looking for a heartbeat that they can safely shock. If it finds such a heartbeat, the orange light will flash, you press the button and the patient will be shocked. If there's no signs of life, resume CPR. Continue for as long as you need to until the emergency services arrive or the patient resumes breathing normally.
Hopefully that made sense how to use an AED. That was a little crash course for you. It's hopefully that gave you a few ideas. If you'd like to learn more, I do lots of office first aid courses for office management group members. Doesn't have to be a whole day. I do half-day sessions, is more than enough for most offices. Even do 1 hour lunch and learns. I bring all the mannequins in you see me using on the video, and people can have a go. And we can cover some other things as well, obviously, if we have more time. If you've got 12 people booked on the course, it starts from typically about £50 per person. I've been with the Office Management Group since 2021, won the Service Provider of the Year award, and got over 300 five-star reviews. So I'll be delighted to come and work with you and in your office and teach you and your colleagues more about what we've covered today. If you're not sure how to contact us, I'm on the Office Management Group Slack system, or I'm in Hannah's little black book, which you'll find on the Office Management Group forum there. You can search for East Saxon Training and find me in Hannah's little black book. I'll stop sharing the screen now. I'm available for any questions if people have any. Okay. Give me a thumbs up if you can hear me. Anybody there? Anybody got any questions for me at all today? Good, Grace. Thank you. Nobody has any questions? Well, thank you very much for your time and attention. I hope that was helpful. And I say you know how to contact me if you'd like to find out more. Thank you very much, Hannah, for inviting us along. Enjoy the rest of your day, everybody. Take care.